When we get information in WHO, we get information in numbers. This many people died or this many people had been infected. We don't see the numbers. We see the individuals behind the numbers. The mother of somebody, the father of somebody, the daughter of somebody, and the son of somebody, or the grandfather of someone.
Those are impactful words from the World Health Organization Director General Dr. Tedros Ghebreyesus. These words are the inspiration behind this initiative by SABC News to bring home the reality of the impact and effect on the lives of people caused by COVID-19. This feature, The Lives They Lived, aims to remember and honor the people who have died from this pandemic. It aims to offer some comfort to the families who have been left behind in the devastating wake of COVID-19 deaths. According to the World Health Organization, as of today, June 28th, more than 494,000 people have died from COVID-19 related cause deaths globally. In South Africa, 2,413 have lost their lives so far. Our reporter Jayed-Leigh Paulse spent some time with the family of a Durban man who lost his 29-day battle with COVID-19. They were shocked when he passed away, as he tested negative just a week before he died. Anton Harman spent a month on a ventilator in hospital fighting for his life. Watch.
My name is Tracy Holman. I was married to Anton John Harman. We were married 28 years. We were married on the 3rd of March. And it was just before the coronavirus, and we went into lockdown. We have a daughter, Etia. She's 22. She's such a blessing and the most amazing part of our lives. The three of us have done things always together. We've never been apart. My husband was very concerned about catching the coronavirus. When we went into lockdown, we would watch the TV. We would obey all the rules. I'm an essential worker, and he would come and fetch me, and we would have our masks on. I would sit in the back of the car. We took all the precautions. He was the only one that went shopping. And people ask you, where did he get it? And I truly don't know. And then got the virus in April. Him and my daughter were tested, and he came back positive and she was negative. And then I was tested 2 days after that, and I came back positive. And then Department of Health came through to our house because I was an essential worker, and they tested her, and her result came back positive then. It was completely devastating. My daughter and my husband had high temperatures, were coughing, had body aches. I had very mild symptoms. I didn't even have a temperature. And we thought everybody would be fine. We isolated together. But as the days grew on, he just got weaker and weaker. And I remember the day before he went into hospital, his temperature was sitting at 39. It just wouldn't break. He went up to the hospital and they admitted him. And it was the last time that I spoke to him. He said he was going into a hike. And later on that afternoon, I got a phone call from the doctor to say they'd placed him on a vent. We weren't allowed to see him. The doctor was amazing. Thank you, Dr. Khan. You phoned me every day and updated me. You answered every single question I had. We would watch the news, we would watch CNN for any signs of a cure, treatment. We tried everything. We really did. He was on the vent for 29 days. Our GP said, no, he's such a fighter. He'll be fine. He'll be strong. He'll come off the vent. And it was a Thursday night, the 21st of May. I would always say to him, love, at 7 o'clock the nurses are going to hand over, you're going to get a new lot of staff and they're going to take care of you. And 7:30 they phoned to say they were busy resuscitating him. Even the doctor phoned about 10 minutes later to say he didn't understand what had happened because he'd had such a good day. They'd bathed him and shaved him. And then they phoned at 8:15 to say he'd gone. You know, people don't realize you cannot even begin to think if you have COVID that you will die. I didn't think that would happen to us. I'm going back to work on the 1st of July. I'm so scared. I have to prepare my daughter now and get my will in order and say, should something happen to me, you need to know what to do. It is tearing families apart. We did everything together. We used to shop together. And yesterday I had to shop and go and get food. I hate going to the shops because all I do is cry. The man that I loved, my soulmate, is not with me anymore. And yesterday we were at the shops and there was a woman there who had a mask on, and she must have had a 3 or 4-year-old little girl without a mask. Come on. You know, is your child worth catching this virus and dying? Where are your priorities? The world needs to wake up. They really do. We are not flattening the curve in South Africa. It's just getting worse. I've got colleagues who've got COVID. I've got family who's got COVID. And everybody is so scared. And everybody is an internet doctor. You know, maybe if this was done, he would have been alive, or if that was done, but it's not. You know, until you get the virus, or you lose somebody, will you understand? I just want people to know that this is not the flu. This is so much more. It's destroying lives.
His passing has really affected the family in so many ways. It honestly feels like we're living in a horror movie or a horrible nightmare, and we can't wake up. All we want to do is just to wake up and everything be back to normal. But this new normal is here to stay. My mother has really been struggling, and so have I. My father and I were really, really close. So close, in fact, that I saw him as a best friend. I had the best dad in the world, and it hurts so much. I miss you so much, Daddy. I miss you so much.
Look, I hear you. It is difficult to watch that. But this is the reality, the pain, the hurt that COVID-19 brings. But I guess there's a measure of solace. We have good men and women on the front line fighting against this disease. Let me get a perspective now. We're joined via Zoom by Dr Kanyiso Tapula, a Johannesburg medical practitioner specializing in clinical research, internal medicine. Doctor, thank you very much indeed for your time.
Thank you so much for having me.
I'm not sure if you heard that insert that we just played a short while ago, the melancholy apparent, the hurt apparent, pain. Take us behind the scenes. Push back the curtain for us, if you will. What goes into taking care of a person who has contracted COVID-19 and needs hospital care?
So from the time a patient comes into a hospital environment, there's a lot of fear and there's lots of anxiety from the staff, the nursing staff, the doctors, the porters. And so one has to really be wearing PPE, personal protective equipment at all times. And I think it's come to the point now with all patients that we're seeing, whether it's a sprained ankle or one who's got respiratory symptoms, needs to be treated as though they have a coronavirus infection.
Yeah.
So it's a very tense environment, lots of anxiety for the staff. And there's lots of anxiety for the patients themselves and for the caregivers.
Right.
So, I mean, as mentioned in the clip, generally speaking, patients who are suspected of having coronavirus are treated in what's called PUI wards. So PUI stands for patient under investigation. So generally patients who we suspect to have COVID are seen in those wards until we have definitive test results.
Yeah.
It becomes very difficult, and it's currently very difficult because there's quite a large backlog in terms of testing. So depending on whether you're in the private or public sector, it can take anything from 1 to about 8 days, which obviously would delay optimal management of patients. But I think also there's a lot of, as I said earlier on, there's anxiety from the patient side because they don't know what to expect. And generally speaking, patients who are suspected of having COVID are not allowed to visit us. So they really walk through this on their own. So family members, friends cannot come see them. So once you're admitted and suspected of having coronavirus, you really are just with the hospital staff.
It is no doubt a tough job, and you and your colleagues are among the best of us. And where there is heroism, there will always be hope. And it seems that all of human ingenuity has been brought to bear to defeat COVID-19. It's just a matter of time, hopefully, sooner rather than later. Dr. Kanyiso Tapula, a Johannesburg medical practitioner specializing in clinical research and internal medicine, we thank you. Be well. God bless.
Thank you so much.
All right, we're going to take a quick break. I'll have more next. I think that was one of the shortest interviews I've ever done in my life. Dr. Nthabiseng Mabena. Dr. Mabena, it's Blaine. Can you hear me? Doctor, it's Blaine. Can you hear me? Doctor, it's Blaine. Can you hear me? Can you hear me? Can you hear me? Dr. It's Blaine, can you hear me?
I can hear you.
100%. 100%. 100%. Thank you very much. Stand by, doctor. I'm going to come to you now. Parks, can I kick you out? Parks? No. Welcome back. Well, I want to discuss the impact of losing our loved ones. We're joined by a clinical psychologist about the impact of losing loved ones during this time. Dr. Nthabiseng Mabena joins us now live via Zoom. Doctor, always a pleasure having you on the program. This novel coronavirus has changed our lives in so many ways, and this includes the way we grieve the loss of a loved one. You know, usually when you comfort someone in a time of grief, it involves hugging, holding, being close to the person. That's out the window now.
We today, the corona has brought us to the unnatural, if I can put it like that, or the non-normal way of doing things. If you think about it, losing someone is painful on its own. Whether you have support or you have someone to comfort you, whether you are able to see their body, it's just naturally painful.
Yeah.
But the coronavirus has made it even more complicated in the sense that some people aren't able to view the bodies of their loved ones, the manner in which they are being buried. In fact, people will say it's like my loved one just disappeared. So that on its own does not bring closure. And we're looking at a situation where we're going to have complicated bereavement. That is brought about by inability to have closure. Inability to have closure. And if you look at the way in which it manifests itself, it's in a form of a trauma. So this is not just your normal way of losing someone like we normally know it.
Yeah, and we know COVID-19
it involves trauma as well.
This trauma comes in so many ways, and we know that COVID-19 is contagious. Often people stricken by the virus are not even allowed visitors. We hear reports from around the world each day of many people dying alone. Some would say, you know, during this time, that's when you need someone around you. You need the love and support of your friends, families, and so on. How does one wrap their minds around this?
Your head is cutting a bit.
So I missed the question.
You know, how does one wrap their minds in terms of this new normal? You know, when you're not even allowed visitors during your time, when you're sick in hospital, you know, how does one overcome this?
You know, at the moment, you actually just find yourself going with what you are being given. And it doesn't make it easy. So how do you wrap your mind around it? I think for now, for those that have not yet lost their loved one, obviously they are already hearing from others how things have been done and somehow preparing their minds. But for those that have already lost their loved ones and did not manage to do the rituals as they know them, the normal things as they know them, it's very difficult. It's really very, very difficult. And this is just where you sit and you go through the process. You go through the process trying to understand what's happening, what this corona, the changes that are happening. And unfortunately, nobody prepared you for them. And unfortunately, for those that have already lost their loved ones, it's just going to really be going through the process and finding support from your psychologist, you know, finding support from your loved ones through the social media platforms.
Whatever you can do.
From how we know you get a hug from someone that you love.
I guess so. We have to go through this route, the online route, so to speak, finding some amount of closure at a time. This uncertain, vexing time is so important. And as Joe Biden, I think, once said, our only hope for those who have lost their loved ones is that someday, when the faces and the names of those who you have lost comes to your mind, a smile will come to your lips before a tear comes to your eyes. Clinical psychologist, Dr. Nthabiseng Mabena, we thank you very much indeed for your perspective. Be well. All right. This slot is honoring those who've died from COVID-19 related causes. And it's linked to the SABC Digital news platform that is hosting a memorial wall. Now, to explain this further, we're joined by Tegan Bedser. Tegan, a very good morning to you, or good afternoon, rather.
Good afternoon. Thank you for having me.
Tegan, tell us more. Tell us about this memorial wall.
So the memorial wall was created by SABC Digital News. It is found on sabcnews.com. It's online, it's interactive. Viewers can already see some of the profiles that have been published, but viewers are also welcome to submit their own tributes and honor their family members and their friends who have passed by submitting via a link on the wall. There's a link to a form, and they're welcome to contribute, and they can do this via sabcnews.com.
All right, Tegan, thank you very much indeed for that. We do appreciate it. The lives, that has been affected by COVID-19. It's devastated a lot of families. So, Tegan Bedser, thank you very much indeed for your time. Well, as COVID infections and deaths climb, a cursory glance at social media, specifically Twitter, is showing where we see the beginning of the impact. I want to put out some tweets for you and get a sense of what we're talking about here. Fort Hare Vice Chancellor Sakele Buhlungu tweeted how he lost his brother, his older brother, and his spouse in the face of a loss of a loved one. Let's go to Nthabiseng. Praise the Minister of Health for his efforts and hard work amid the rising number of infections and deaths. And earlier this week, presidential spokesperson Kusela Diko spoke about the emotional pain of losing a loved one. It gives you a sense of what people are dealing with around South Africa and indeed around the world. Well, frontline workers are particularly susceptible of contracting the virus. In the Eastern Cape alone, close to 800 healthcare workers from both public and private sector tested positive. More than 20 have paid the highest price. And the loss the Maneli family is still grappling with.
My wife was the backbone of the family, a very strong person who was always motivating all of us, including my children. So it was really a sad thing to lose my wife.
Memories of a grieving husband. Kanyile Maneli lost his wife of 36 years to COVID-19. 58-year-old Matilda started working at Victoria Hospital in Alice soon after tying the knot. She was in charge of the hospital's stores. Receiving and distributing linen and patient clothing was part of her job.
She was a very dedicated person. You could see even after work, she would always think about the work that she has not completed at work. You could get that from her colleagues at work, that really she was this type of person who would want to see everything done properly and professionally.
The mother of two also reached out to impoverished communities.
She wasn't just my mother. She was everybody's mother. People could come to her for the smallest things and confide in her. And she was just that person who's always willing to give, even if she's sick.
She is sorely missed by her family.
Every time I see her, things like I cry, and if she would have been here, I think we would be laughing. And then we would be cooking.
I want my wife to be remembered as a very dedicated person. She was dedicated up to the last. She died with her boots on.
The family has paid tribute to other workers putting their lives on the line, fighting the pandemic. Yanga Funani, SABC News in the Eastern Cape.
Brothers and sisters, that brings to an end the first edition of The Lives They Lived, a program that aims at honoring those who have lost their loved ones due to COVID-19 and trying to bring some sort of comfort to them. We are calling on families who have lost their loved ones due to COVID-19 to please send us their video clips and pictures to feedback@sabc.co.za. Feedback@sabc.co.za. The news continues. I'll hand it over to Flo Letwaba. Have yourself a great day. Take care. Bye-bye.